When conception occurs, the fertilized egg journeys into the uterus through the fallopian tube, where it implants itself. But then, what happens if this fertilized egg never gets to the uterus? What happens if it implants itself outside the uterus? The situation whereby a fertilized egg implants itself outside the uterus is called an ectopic pregnancy. That is very dangerous and it could be life threatening. The uterus is designed in such a way that it houses the fertilized egg and there it keeps developing until it is delivered. So, if a fertilized egg is allowed to grow in any other place outside the uterus, it will not survive there. It therefore means only one thing: it needs to be discontinued. A woman who is having an ectopic pregnancy may not know she's having an ectopic pregnancy. She may not be able to differentiate between an ectopic or a normal pregnancy. This is because they have similar symptoms. However, there are some warning signs in ectopic pregnancy, ranging from vaginal bleeding. When the woman experiences vaginal bleeding, it is not her period. Yes, it is not even time for her period yet, and she's experiencing vaginal bleeding. That could only mean wanting an ectopic pregnancy. Also, when the woman experiences sharp pain, either in her pelvic region, the abdomen, or the sides of her abdomen, either the left side or the right side, depending on where the ectopic pregnancy occurs. Yes. And then she may also experience bloating, which is usually accompanied by vomiting and nausea. This is similar to that of morning sickness. So she might not really be able to know that it is an ectopic pregnancy. She may also experience dizziness and fainting. This is because ectopic pregnancy may lead to internal bleeding. The woman may not know that she is bleeding and she will lose a lot of blood. That will lead to dizziness and fainting, and she might attribute it to early pregnancy symptoms. No, it is not. The commonest site where an ectopic pregnancy occurs is usually in the fallopian tube. However, it can occur anywhere in the reproductive organ, such as in the cervix, on the ovaries, or even in the abdomen or any other place. But the commonest site is the fallopian tube. The primary cause of an ectopic pregnancy is when the woman have issues with her fallopian tube. These issues will therefore impede or interrupt the movement of the fertilized egg into the uterus. It hinders the movement of the fertilized egg into the uterus. These issues ranges from infections, PID, gonorrhea, chlamydia. They can cause scar in the fallopian tube if not properly treated, which will lead to ectopic pregnancy. Secondly, if the woman have had previous surgeries such as to remove appendix, cesarean section, fibroid, or any other related surgery, she may experience ectopic pregnancy because sometimes these surgeries leave a very big scar in the woman's fallopian tube or in her reproductive organ, thereby leading to ectopic pregnancy. Also, there are some women who were born with an abnormal fallopian tube, yes, birth defect. So that also can cause ectopic pregnancy. Endometriosis can also cause ectopic pregnancy. Endometriosis is a situation whereby tissues that are supposed to grow in the uterus now grow outside the uterus. So the treatment, it usually requires surgery also. So that surgery can also leave a scar leading to an ectopic pregnancy. Smoking is another factor that can affect the movement of the fallopian tube, thereby hindering the fertilized egg to reach to the uterus. Ectopic pregnancy, like I said earlier, has a lot of complications. It is life-threatening, and if not managed properly, it could even result to death. So it can be managed in the early stage with medication, while in the later stage, the only option is surgery. So some of the complications of ectopic pregnancy ranges from removal of the fallopian tube. So we all know that the woman has two fallopian tubes. Imagine now that she had an ectopic pregnancy in one of the fallopian tube And then this fallopian tube, sometimes it ruptures because the fallopian tube is narrow. It's not like the uterus, which is designed to house a fertilized egg and it develops into a fetus till it is delivered. No, the fallopian tube is narrow. It doesn't have muscles that stretches like that of the uterus. So as this fertilized egg is developing, there is this tendency that it will rupture the fallopian tube. Yes, it will burst the fallopian tube. And in that case, the only option is surgery to remove that fallopian tube. So imagine that one fallopian tube is removed and then she experienced another ectopic pregnancy in the future and it also happened the same way just like the first one. She will be left with no fallopian tube, which leads us to the second complications, infertility. So ectopic pregnancy can lead to removal of fallopian tube, which in the other hand leads to infertility. It also leads to internal bleeding. Yes, in this case, the woman may not know she is bleeding. And as she is bleeding, she's losing a lot of blood. Her blood pressure will drop. And then it will lead to dizziness, to fainting. And if care is not taken, it will result in death. May God forbid that. So, internal bleeding, and then it can leave the woman traumatized for a long period of time. So psychological aspect is also there. The good thing is that ectopic pregnancy can be prevented. So it is very, very important, since you already know that one major cause of ectopic pregnancy is infection. It is very, very important to get proper treatment for your infection. If you suspect a case of infection, it's very important for you to see a gynecologist and get proper treatment to avoid stories that touches the heart in the future. Number two, it is very important for a woman to register for antenatal early enough. Once you suspect that you are pregnant, just carry yourself to the hospital, run the necessary tests, and then have the first scan done on you. It is during that first scan that you will know if you're having an ectopic pregnancy or if you're having a normal pregnancy. There are a lot of women who usually, most especially women who have had children, yes, maybe it is their third, fourth, or fifth child, they don't usually register for antenatal. Even if it is your 10th child or your 100th child, it is very important for you to register early enough for antenatal because it is during that first scan. That first scan is very, very important, and it is very important to do it very early because it is during that time that you will know if it is an ectopic pregnancy. If it's an ectopic pregnancy, it will be diagnosed early, it will be dictated, and then you'll be given proper treatment. Also, it is very important for the woman to practice healthy lifestyle. Eat good food, exercise yourself, and then avoid unhealthy habits that may be harmful to your reproductive organ. If you're the type that smoke, it is very important for you to quit smoking. And lastly, it is very important for the woman to start taking her prenatal vitamins very early, even before she conceives. Yes, folic acid, folate, very, very important. So please, if you find this video educative, if you find it informative, don't forget to like, share, and if you're yet to subscribe, don't forget to also do that. To my returning viewers, you guys are the best. I love you.